Hello, everyone. I'm Ron Rolfing, your host of the ACAP Preferred Vendor Education Series, and I'd like to welcome you to our latest session presented by Freespira. Our presenters today are Dr. Malika Closson from Closson Psychiatric Consultants and Michelle, who is a Freespira patient. And they're discussing post-traumatic stress disorder, the cost of untreated trauma. But before I turn it over, I do have a few housekeeping items I need to take care of. This webinar, along with all ACAP calls and webinars, will be held in accordance with the ACAP antitrust guidelines, and these guidelines can be viewed on our website. We will be recording today's call, and we will post the slide deck and recording on our website by tomorrow morning. And the link to these items can be found in the invitation sent to you for this webinar. And please remember, if your plan is looking for a vendor, be sure to check out our list of preferred vendors on our website. Just look to the top of our homepage, click on the preferred vendors link, and you will see a list of all our preferred vendors. You can also post an inquiry, an RFI, or even an RFP on our preferred vendor connection portal. And of course, during today's session, you can ask a question at any time by clicking the Q&A icon on your Zoom window and typing in your question. And all questions will be answered at the end of the presentation. Now, I'll pass it over to Monica Frederick from Freespira to get things started.
Thank you so much, Ron. We're just thrilled to be here today. I'm Monica Frederick with Freespira. Just a little background, Freespira is an FDA-cleared digital therapeutic for the treatment of post-traumatic stress disorder and panic disorder. And I want to give just a little background about the company. Freespira was founded with a tremendous amount of passion. There was a woman who was suffering with panic attacks, and she enrolled in the study at Stanford University and was so thrilled with the outcome, essentially eliminating her panic attacks, that she founded the company based on the Stanford study treatment protocol, and that's what we deliver to patients in their homes today. With that, let me turn it over to Dr. Closson to begin the webinar.
Good afternoon, everyone. Thank you so much for joining. I am glad that you are here. So my name is Dr. Malika Closson. I am a double board certified adult and child and adolescent psychiatrist. And just in terms of my background a little bit, I've spent much of my career treating and serving a primarily Medicaid patient population. So I started off in direct clinical care, working in community mental health outpatient clinics. I then transitioned to a physician advisor role at my state's health department, also within the Medicaid division. And then following that, I've sort of transitioned into more administrative consultative roles, again, with a primary focus on the Medicaid patient population. So the reason that I've gravitated toward a Medicaid patient population is because when I started off in residency training and fellowship, I really saw that there was a subset of our population, our traditionally underserved populations, who really had difficulty accessing quality mental health treatment. And so I kind of became passionate about ensuring that traditionally underserved patient populations do have equal access. So today I'm talking to you about PTSD and the cost of untreated trauma. Do keep in mind that while I'm going through my presentation, although it's focused on PTSD, I'd really like you to keep in mind that at a high level, not only is PTSD under-recognized and undertreated, but also are many of the other common mental health conditions that we see. So with that, I'll go ahead and get started. So I want to talk briefly about sort of what the current state of mental health is in the US. So what we know is that about 50% of Americans will experience a behavioral health issue in their lifetime. We know that despite this, less than 50% of people with a mental illness can actually access care in a timely fashion. There's been a lot of talk about what the impact of the COVID-19 pandemic was on mental health symptoms and issues. And so I want to spend just a brief amount of time talking about the impact of the pandemic. So between August of 2020 and February of 2021, that's sort of at the height of the pandemic, the percentage of adults reporting anxiety or depressive symptoms increased from 36% to about 41.5%. In that same time period, the percentage of people who reported an unmet mental health care need increased from 9% to a little over 11.5%. What we also saw is that the increases in unmet need were largest among adults 18 to 29 and those with less than a high school education. So what we start to see is that the pandemic did disproportionately impact certain subsets of our population. Moving forward into February of 2023, so sort of at the end or toward the end of the pandemic, this slide depicts the share of adults reporting symptoms of anxiety or depressive disorder. So what we see is about 32% of all adults reported symptoms of anxiety and or depression as of February 2023. That doesn't seem like a huge percentage, but when you actually stop and think that that's about 1 in every 3 adults, that sounds pretty significant. And then what we also see is that once again, our 18 to 24-year-old age range was the most severely impacted, with about 50% of those aged 18 to 24 reporting anxiety and depressive symptoms. So again, we see sort of a disproportionate impact among certain subsets of our population. This next slide is from Mental Health America. Again, just sort of talking about where we are in terms of mental health in America as of 2023. I won't walk through the whole slide, but I do want to point out a few key figures. So the first is that 55% of adults with mental illness receive no treatment, and that represents over 28 million individuals. We see that 60% of youth with major depression do not receive any mental health treatment. And lastly, I want to point out that in the US, there are about 350 individuals for every 1 mental health provider. And I will be talking a little bit about the mental health provider shortage later in my presentation. Next, I want to give an overview about what PTSD is. So I'll walk through sort of the main symptom components. But PTSD has been described as the, quote, complex somatic, cognitive, affective, and behavioral effects of psychological trauma. This quote is actually from Bessel van der Kolk, who is one of the preeminent trauma researchers in our time. And I like his definition because it speaks to the complexity of PTSD. So it points out that it's not just a disorder that impacts mental health, but it has effects on other areas of one's life, including mood, behavior, and even physical conditions. It does consist of 4 main symptom components. The first is re-experiencing or intrusion. So this can include things such as spontaneous, distressing memories of the event, flashbacks, nightmares, and then patients can have marked physiological reactions on exposure to certain cues that symbolize the event. So again, that sort of points to the fact that it does impact the body as well as the mind. The next key symptom component is avoidance. So people with PTSD seek to avoid those distressing memories, thoughts, feelings, or external triggers of the trauma. I like to point that out as a key feature of PTSD because when we start to think about treatment, we know that folks with PTSD don't necessarily want to talk to their trauma, and so it does impact how often they seek out treatment. So I always like to keep that in mind when folks are talking about PTSD. The next symptom component is negative cognitions and mood. So this actually varies widely from patient to patient, but it can include things such as an inability to remember key aspects of the event or persistent exaggerated negative beliefs about oneself or the world around them. So negative cognitions can include things such as, no one can be trusted, I'll never be okay again, and things such as that nature, or even things such as it's my fault. And so you can imagine how those negative cognitions would impact one's mood. The next symptom component is arousal or hyperarousal. And this can be marked by irritability, anger outbursts, and even can include aggression, reckless or self-destructive behavior. I like to point that out when I'm talking about PTSD, because it's not something that people typically think about when you think about a diagnosis of PTSD, but it is a component, a main component of PTSD. So when we start to think about, moving about our day-to-day lives, whether professionally or personally, we do encounter people who come across as irritable or angry with really no clear trigger. We meet people that say that they can go from 0 to 100 very quickly, again, with very little provocation. And so not that I'm encouraging diagnosing anyone that's not in direct treatment with you, but I think if we could sort of expand what our idea of PTSD is, that would be helpful. And it can include all of these things. Also under the arousal or hyperarousal component, there's things such as exaggerated startle response or problems with concentration or sleep. So overall, what we know is that PTSD symptoms can lead to significant dysfunction in multiple areas of one's life. This is just the DSM-5 criteria for PTSD. I've already sort of walked through most of it in a broad sense. I won't go through all of this. This is mostly for your reference. Next, I'd like to talk about events that frequently lead to the development of PTSD. And I do want to point out that not everyone exposed to a traumatic event will go on to develop PTSD. And turns out that about 30% of people who are exposed to a trauma go on to develop PTSD. The events that cause PTSD are not something that we're probably not all familiar with, but I'll kind of walk through this anyway. So things such as childhood trauma, sexual assault, mass conflict or displacement, such as what we see in war-torn areas of our world, physical injury, and combat. And I do want to point out that certain medical illness or experiences can actually result in PTSD. So later in my presentation, I will be talking about the link between PTSD and chronic medical conditions. But what we see here is that certain medical conditions can actually result in PTSD. So for patients who've experienced a heart attack or myocardial infarction, about 13% of those go on to develop PTSD. For patients who've had a stroke, it's up to 23% who can go on to develop PTSD. And then also for patients who've had an ICU stay, about 22% of those go on to develop PTSD. In terms of prevalence of PTSD in the general US population, lifetime prevalence in adults ranges from about 6% to 9%. One-year prevalence rates are about 3.5% to a little over 4.5%. And what we see is that there are higher rates among certain subsets of our population. So females, our Native American and indigenous populations, refugees from countries where traumatic stress is more endemic, and then individuals who have less than a high school education, lower incomes, and residents that live in rural areas. So what we can see clearly here is that there are certain subsets of our population that are disproportionately impacted by PTSD. Next, I'd like to talk a little bit about PTSD as both a risk factor for chronic medical conditions as well as for poorer health outcomes. So in terms of cardiovascular disease, there's been a large body of literature that's found a link between depression and cardiovascular disease. But what we also see is that PTSD is also linked to cardiovascular disease. So while it's not yet considered an independent risk factor for PTSD, it has been shown to be linked with major risk factors for cardiovascular disease, as well as with poor outcomes related to cardiovascular disease, such as hypertension, elevated lipids, MI or myocardial infarction, and heart failure. There was one study that showed that PTSD was associated with a 27% increase in incident cardiovascular events. So an additional cardiovascular event after the initial, or cardiac mortality. And this held true even after adjusting for depression, as well as demographic, clinical, and psychosocial factors. PTSD has also been found to be a risk factor for certain autoimmune disorders. So things such as lupus, multiple sclerosis, psoriasis, rheumatoid arthritis, and inflammatory bowel disease. So studies have shown that veterans who had PTSD were twice as likely to have autoimmune disorders versus veterans with no psychiatric diagnosis. And the risk for lupus, MS, rheumatoid arthritis, and/or inflammatory bowel disease was 58% higher for U.S. active duty service members with a history of PTSD versus those who had no such history. I do want to take a step back just for a second to point out that while the bulk of studies on PTSD have been done in a military population, studies that have been done in civilian populations actually show pretty consistent outcomes as to what was found for military populations. So I just kind of wanted to take a moment to point that out. I also want to note that even PTSD symptoms that don't meet full diagnostic criteria for PTSD, so sort of those subclinical, subthreshold PTSD symptoms, they have also been found to be associated with a twofold increased risk for lupus in women. And again, this is even after adjusting for other known risk factors for lupus. In terms of PTSD as a risk factor for poorer health outcomes in pre-established chronic medical conditions, there have been several different chronic medical conditions that have been looked at. So the first is multiple sclerosis, where in patients who have multiple sclerosis and a pre-existing diagnosis of PTSD were actually found to have higher disease activity as well as to reach disability endpoints more rapidly than controls who did not have a diagnosis of PTSD. A similar study was done looking at patients who were 25 years or younger who had type 1 diabetes. They looked at patients with type 1 diabetes and comorbid PTSD versus patients who had type 1 diabetes without PTSD or any other mental health diagnosis. And what they found is that the patients with comorbid PTSD had significantly higher hemoglobin A1C values. They had more hospital admissions. They had longer hospital stays when they were admitted. And they also had higher rates of diabetic ketoacidosis or DKA. Similarly, in type 2 diabetes, they found that women with the highest number of PTSD symptoms had a nearly twofold increased risk of type 2 diabetes versus women without a history of trauma. And studies have also shown that individuals with PTSD are at higher risk for things such as bronchitis, asthma, and liver disease. Again, this is even after adjusting for sociodemographic factors, risk factors, depression, and alcohol use disorders. So what we know is that PTSD is associated with more health problems, decreased physical functioning, decreased overall health, greater service utilization, including emergency department utilization, and an increase in mortality, specifically premature mortality. So there was one meta-analysis that estimated that individuals with PTSD had a 29% higher risk of mortality versus those who did not have PTSD. And once again, I want to point out that even subclinical PTSD symptoms have been associated with increased risk for developing physical health conditions. Next, I want to talk briefly about a study that looked at the economic burden of PTSD. So in this study, they looked at economic burden measures consisting of direct healthcare costs, direct non-healthcare costs. So this included things such as research and training to treat PTSD and homelessness, as well as indirect costs such as unemployment or loss of productivity. What they found in this study is that the excess economic burden of PTSD was about $232 billion. $189.5 billion was found within the civilian population, while $42.7 billion was found within the military population. And what that averaged out to is about $19,000 per individual with PTSD as it relates to excess economic burden. In the civilian population, they found that this cost was driven by direct healthcare costs and unemployment, whereas in the military population, they found that it was driven by direct healthcare costs and disability. So again, we can sort of see a link between PTSD impacting physical health, and then with that comes increased cost due to increasing healthcare costs. Next, I want to just talk briefly about cost issues in general related to specifically mental health treatment. So what we know is that specialty care is associated with higher costs. We know that out-of-network care is more common for mental health. And then we do know that the multi-pronged care approach required for mental health treatment, such as, the combination of psychotherapy, medication management, and prescription costs, it actually tends to increase costs by about 2 times. The other thing I do want to point out is that in terms of that cost average for 12 sessions of psychotherapy, specifically for PTSD, depending on which therapeutic modality is used, that cost could actually increase because the required number of sessions can be up to about 16 sessions. And then finally, we do see that reimbursement challenges drive some of this cost issue. So we know that about 45% of psychiatrists do not accept any form of insurance. And we know that behavioral health providers generally get about 24% less reimbursement for similar services compared to their general medical peers. Next, I'd like to spend a few minutes talking about barriers to mental health treatment. I mentioned earlier in my presentation that there are certain subsets of our population who tend to be disproportionately impacted by things such as PTSD. And so when I talk about barriers to mental health treatment, I specifically like to talk about 2 broad terms: health disparities and health inequity. So a disparity is a health difference that's linked with social, economic, and/or environmental disadvantage, while a health inequity refers to the fact that there are certain groups of people who experience greater obstacles to health. And this is generally determined by 5 key factors, such as differences in health insurance coverage, affordability, access to care, use of care, and quality of care. And I'd like to spend a little bit of time talking specifically about access issues. So what we see is that about 20% of the US population lives in rural areas. About 37% live in mental health professional shortage areas. And what we do know is that there is a growing shortage of mental health professionals in rural and low-income areas. This map depicts mental health professional shortage areas by county as of May 2023. The dark blue represents areas where an entire county is considered to be a shortage area, whereas the lightest blue represents areas where none of a county is perceived to be in a mental health professional shortage area. And what we can see is that as of May 2023, there are large swaths of our country that are in areas that have a county where the entire county is in a mental health professional shortage area. The thing to note about this is that this mental health professional shortage is actually projected to grow through the year 2036. And this slide is sort of a good depiction of this. I won't walk through everything on the slide, but I do want to point out that the demand for mental health professionals is expected to increase by about 62% through 2036, whereas the actual supply of mental health professionals is projected to decrease by 13%. What that means is that there will be a 53% adequacy of mental health professionals to be available to treat those patients who need access to treatment. So next up, when we start to think about solutions to address this phenomena of increased demand in the face of decreased access to mental health treatment, we know that solutions have to be innovative, including meeting patients where they are. As we saw from that health professional shortage area map, most people in our country do not have ready access to mental health treatment. So we know that innovation has to include meeting patients where they are. Other solutions, other things that we know about solutions is that they need to be clinically effective as well as cost effective. And Freespira, which Monica mentioned, is an FDA cleared at-home device plus coaching for panic disorder and PTSD, actually meets all three of these criteria. So next, I would like to introduce Michelle, who is a patient who completed treatment with Freespira, and she has agreed to come to talk to us today about her real world experience with the Freespira treatment. So thank you so much, Michelle, for joining us. We appreciate you being here.
Absolutely.
Could you start up by just telling us a little bit about yourself, where you grew up, a little bit about your background, where you live now, and how old you are?
Yeah. So I am a 40-year-old stay-at-home mom. I quit my job about 9 months ago to stay home with my 1 and 3-year-olds. All of the challenges of raising children with daycare and sick and all those things, I decided to stay home. I grew up on a farm in Iowa, and now I live in Milwaukee, Wisconsin. So I definitely understand what you were talking about with the urban and rural experiences and access to healthcare.
Okay, so can you tell us a little bit about your symptoms, your experiences, what your life was like prior to doing the Freespira treatment?
Yeah. I, I always use the words like I just felt overstimulated all the time, and it felt really hard. Like once I would get overstimulated, it felt really hard for me to come back down from that. Like I would just be exhausted for the rest of the day. My breathing would get shallow, my stomach would tighten, my mind would race, and yeah, it was just constantly feeling overwhelmed and overstimulated.
And can you talk to us a little bit about how that impacted your life? Like, did you avoid things that you wanted to do, or just talk a little bit about the impact?
Mhm. Yeah. Yeah. So I felt like a terrible mom, because I would be irritable and I would lose my temper with my kids, and I was not being the mom that I wanted to be with them. We Me being home, my partner works in cars. So he's gone, 14, 16 hours a day sometimes in that industry. So I'm with the kids all on my own. So I was like, I really need to figure out a way that I can maintain my composure and my kind of, I don't know, felt like my sanity while I was with my kids. And I didn't want to take them anywhere because I was afraid that I was afraid of the energy drain, and I was afraid that I just wouldn't be able to get through my day, or that I was going to lose my temper. And it wasn't worth it. And being a stay-at-home mom is already really isolating. And then like being afraid to go out in public because I'm afraid I can't manage my emotions with my kids makes it even more isolating.
Okay, thank you for that. So can you tell us a little bit about how you felt when you learned that your health plan offered Freespira as a treatment, particularly with it being a treatment you could do at home?
I I thought it was awesome. First of all, I would never be able to get a treatment. I can't even find like somebody to watch my kids for an afternoon. That's the world we live in, not living around close to family. So I was like, wow, I can't believe they're sending me information to get treatment for something like this. This is really interesting. And I didn't know if I would qualify because I didn't know that, what I had was like panic disorder or PTSD, but I decided to go ahead and reach out. And I was really pleased to find out that my symptoms made me qualify for Freespira.
And you mentioned that, there were challenges sort of with you living in a more rural area. Had you tried other treatments before or tried to access treatment? And if so, did you run into any roadblocks or barriers in trying to do so?
Yeah, so I guess I had actually tried here living in Milwaukee. I had tried to establish a relationship with a therapist. And this was even before I had kids. And it's first of all, you have to figure out like like where you can go. And it's really challenging to figure out where you can go and where you can use your insurance. So I finally did find somebody and she was awesome. It was like within walking distance of my house. And I had one meeting with her and was like, we just didn't click. And I'm like, I can't possibly go through this entire experience again trying to find somebody else. And I just gave up.
Yeah, and you bring out a good point in terms of, I mentioned it earlier with PTSD patients who tend to avoid seeking treatment, but even for patients who actually are seeking out treatment, there are definitely, you're pointing out challenges, barriers, and things that they kind of have to overcome, which may actually end up resulting in them not accessing or getting into treatment. So that's a really great point that you bring out there. So can you tell us a little bit about how your life is different now that you've completed the free spirit treatment? How are your symptoms? How is your quality of life? If you could speak to that just a bit.
Yeah, I feel like so I'm somebody that I've done yoga and I've tried meditation. Like I am not foreign to the world of mindfulness, but something about Free Spirit was totally different. And I was like, I don't know. I mean, like when I went in, I was like, I don't know if this is gonna help. I've tried meditating, I've tried yoga, I don't know, but I'll give it a try because like I have nothing to lose, right? Like it's breathing, like there's no side effects. So I'm like, okay, I'll do it. And after I finished my treatment, I went camping with a girlfriend and she was like, this is the calmest I've seen you in 20 years that I've known you.
Wow.
I was like, yeah, I was like, it feels weird. Like I feel so good and so calm. And, I can say too, like that I appreciate like this tool because when my treatment was done, I was nervous because I'm like, wow, I took two 17-minute periods of my day to just kind of bring my energy and my stimulation and everything back down to like a reasonable base level. And I was nervous about quitting, having the treatment stop. I was like, can I continue this? Like it's working. And it was great that they have an app that you can download so you can still, you don't get the feedback as far as like your levels, but you can still do the breathing with the tones. And I use that actually still quite frequently. So I still have this tool that I can continue to use.
Great. And can you tell us a little bit about what it was like working with your coach? Because I know that Free Spirit includes a coach.
Mhm. So yeah, she was awesome. She was super friendly, really approachable. I appreciated that like it was like no judgment. I could just ask her questions. She encouraged me to reach out anytime via email or text message if I had any questions. And yeah, and I was never nervous to meet with her. And I feel like that's something that's also just a barrier. I mean, you're making yourself vulnerable when you are dealing with mental health issues. So it was just really, really comfortable to meet with her.
And do you think that you would recommend free spirit treatment to other patients? And do you think that it would have an impact if more patients had access to it?
Yeah, I did actually. So right after anybody that I talked to, like if they're like, oh, my so and so, like my niece or my cousin or my whoever suffers, like they have PTSD or like, oh, somebody had a panic attack, they couldn't come tonight. And I'm like, have they heard of Free Spira? Like maybe they should try it. Um, because like I said, like you have nothing to lose. Like it's such a simple treatment. It's 2 quick sessions a day. Um, so yeah, and honestly, I think that I mean, I'm not a doctor, but I feel like it would be great for people that don't necessarily have like PTSD or like maybe if they just have anxiety or, like, what I consider is like, I just feel overstimulated, or like I've always felt like a really high strung person. Like, I think it could be great for lots of different things.
Great. Thank you so much for joining us. Is there anything else that you want to say about your experience, about Freespira, anything else?
Yeah, I guess I made a couple notes. I didn't forget a couple things, but I guess like I think just being able to do it from your home and not have to go anywhere. Like, we live in a busy world where we all have a hard time finding time to do things. I think the accessibility of that made it super easy, but also there was accountability built in there, because I knew that each time I did my breathing treatments, it would get logged into the system, so my coach could kind of see how I was doing. And it was also really cool because my my 3-year-old, when she would see me with the cannula in my nose, she would say, "Oh, we have to be quiet. Mommy's doing her breathing." So
Oh.
I considered keeping the cannula just so she could still do it. Um, but yeah, I think that that's it. But I guess I just feel a lot better, and I really do. I hope more people have access to the program.
Thank you. And, to your point, I'm here because I really believe in access and folks being able to access the treatments that they need when they need them. So I so appreciate you coming to talk to us about your experience. Thank you so much.
Yeah, thank you.
So we do have time for questions. Not sure if any questions came into the chat.
Well, I just wanted to remind everyone that if you do have questions, you can type those into the Q&A window. Just click on the Q&A icon in your Zoom window to bring that up, and then type your questions in. We do have a couple. First, I have heard the term complex PTSD used. What is it, and how is it different from regular PTSD?
So complex PTSD, while it's not an actual DSM-5 diagnosis, complex PTSD has been used to describe trauma that has been either prolonged or repeated. So patients who are exposed to either repeated traumas, they could be different traumas, or prolonged trauma over a long period of time, tend to develop what we term complex PTSD. Basically, what that means is that because of the nature of their trauma, their symptoms tend to be a little bit more severe. And where they suffer the most tends to be in that area of negative cognitions and emotions. They have more severe symptoms in that area, and then that tends to impact their interpersonal lives a little bit more. So that really is what complex PTSD is. Some people think that it sort of aligns with, there is a subset diagnosis of PTSD with dissociative symptoms. And so a lot of people feel like complex PTSD is sort of encapsulated by that. But again, it's not a separate diagnosis necessarily. It just means that the trauma has been more chronic. So repeated exposure or prolonged exposure.
Okay, our next question. How long does the training last? They're interested but can't find that information.
Um, is that a reference to the Freespira protocol?
I believe so, yes.
Okay. If that's a reference to the protocol, it's basically two 17-minute sessions per day over 28 consecutive days.
Okay. Yeah, if that doesn't answer your specific question, just let me know in the Q&A, and we'll address that. For our next question, can the free spirit treatment be adjunctive to psychotherapy or medications?
Yes, it definitely can. And from my perspective as a psychiatrist, I really see it as a useful adjunct for folks who are in therapy and maybe starting medications, because what we know is that medications to treat anxiety, PTSD, panic disorder, they take time to work. So that's about 4 to 6 weeks. So while those medicines are working, taking time to get to therapeutic levels, the Freespira treatment fits in very well because it's a 28-day treatment. So, but yes, it is an adjunct.
Okay, we did have a note saying, please thank Michelle for sharing her story with us.
Yes,
And
thank you, Michelle.
we all do that. Thank you. Can you tell us specifically what the coaches do?
Yeah, so that's a fairly common question. What I do need to point out is that the coaches are not doing psychotherapy. Really, what they're doing is training and guiding the patients on how to use the device via virtual health. So it's more of a patient support through how to use the device appropriately. So physiological and symptom surveys are done on the device, and that information is fed back to the Freespira coach. So coaches can actually see how often and how long a patient is using the device, and then use that information to give specific guidance in order to increase engagement, improve adherence, and that sort of thing. So the coaches can develop personalized and specific coaching to help each individual patient stay on track with their treatment. At the end of the treatment, what happens is that patients generally have achieved the self-management skills that they need to be able to manage their anxiety, panic attack symptoms, PTSD symptoms.
Okay, our next questions, and this is a two-part question. First, could you describe the device itself? Was the first question. And second is, how do therapists get access to it, and where do we refer?
So I wish I had the device with me. I actually had an opportunity to demo the device myself, but the device is pretty small. It's about maybe this size, and it comes with a nasal cannula that you hook into. In terms of the best way to refer patients, I am going to direct you. I'm going to go to my next slide. What I'd really like you to do is reach out to Monica Frederick, who is the Senior VP of Strategic Accounts over at Freespira, and she can sort of give you guidance on how to best connect your patients with Freespira.
Okay. Well, that looks like that takes care of our questions for today. With that, I'd like to thank all of our attendees for taking time out of their schedule to join us today. I'd also like to thank Dr. Closson and Michelle for a very informative webinar, and especially Michelle for sharing her experiences with us. Just a reminder that the slide deck and recording will be posted on the ACAP website by tomorrow morning. So thanks again and stay safe.
Thank you.